This is Dr. Azizzadeh. You are listening to the Smile Podcast, where I will be sharing with you my unique and holistic perspective on beauty, health, and wellness.
Hello. Millions of people have surgery every year.
Or you could just get a boob job.
Using targeted Botox can be a miracle.
Smiling like that is a skill.
Your surgery has been successful. Hello, everybody, and welcome to the Smile Podcast. I'm Dr. Azizzadeh, and we're doing our Smile Podcast through Zoom through these times of coronavirus. And today I have a very, very, very special guest, Dr. Katrin Azizzadeh, who is not only one of the best dentists, but my sister. And this is like so awesome. And I think our mom is going to be like ecstatic to see her children be on a podcast together. And we're so lucky to have Kathy give us some input on the world as we know it has changed with coronavirus, and how it's changed dentistry, and what you need to do as as a person during these times with your dental care, and just kind of get some more input on how this has impacted Kathy's practice and life. So welcome.
Thank you. Thank you, Babak, for having me do the podcast with you. It's very exciting. Smile podcast is something that incorporates teeth, beautiful smile, and what you do in your line of work, which is amazing.
Yeah, we're gonna have Dr. Kathy come on at another time to discuss the beauty part of the cosmetic dentistry part. But today, part of the Smile Podcast is beauty, health, and wellness. Today, we're really gonna focus on the health and wellness part. And yeah, the smile is everything. And with teeth, that's one of the most important things. And we talk about how people who have beautiful smile generally have beautiful teeth. So you help them achieve that.
So now we rarely see people smiling because of the anxiety that we are facing right now because of the coronavirus. So that is that even has an impact on my patient, and I'm sure on your patients. I had a few phone calls. My patients are breaking their night guard because they're clenching and they're anxious. And,
oh, wow.
Some of them call me and tell me that they have all their teeth are hurting, and it's mainly because they're clenching.
Anxiety. Yeah.
All these things has a big impact, these anxiety, and has impact on our patients mainly.
Yeah, so you just give a little background on your life. You went to UCLA undergraduate, then the University of Pacific. I was lucky enough to be actually the very first person you ever did any operative procedure on. So you've been officially my dentist for almost 32 years.
That feeling, I think, is still there for someone.
Yeah, no, and I remember it perfectly. We had to have that damn thing on my mouth, and I was like choking on it. But
right.
And your practice is in Los Angeles and city of Encino. So I've always said the dental offices have been the cleanest and most hygienic out of all healthcare offices, including, honestly, like you see operating rooms and dental offices are very, very similar. Now, this coronavirus has a very, unfortunately, a bad circumstance that is going to bring to the dental offices. So tell us a little bit about why the coronavirus is going to impact the dental offices and what the issues are for dentists. And dentists are at the highest risk of actually contracting coronavirus.
Yeah, we're like the OSHA, where they, grade the categories. We are at the highest risk right now for coronavirus and contracting it. The reason one of the main reason is that patient can come to us and we can just screen them before coming to us, and they might not have the symptom, but they might carry the virus. So testing is the main part that has to be done for our practice. When we see patients, I don't believe just screening the patients can be enough to keep our operatory safe and our practice safe. So that's one part that is very important for us to see how we can target it, how we can do testing, how we can do in-office testing for our patients. And the other part of dentistry that exposes dentists and the patients is the aerosol. It's the particles. Coronavirus is, they can be as small as 0.1 micron, which they can spread so fast. They can even go as far as 20 feet and sit on a surface, and they can be in the air for 3 hours. So these are the current studies. Everything changes day by day by different kind of experiments and studies. But that part of aerosolization is a big concern for dentists and for our area of practice.
Now, why is it that during dental care you're going to see a lot more of that than, let's say, I don't know, someone who's going to a pediatrician and they're checking their throat?
Because the handpieces we use, the instruments we use, they can splatter the particles. And most of the time, the coronavirus, they're in your nasopharynx, they're in your mouth area. So the spread of it is very easily. So it can spread really fast. And that's why, with sneezing, coughing, and aerosolization, those are the three big exposure of people to the virus. And that's the main issue. So we are completely exposed to the virus as professional.
So let's talk about, obviously right now, most dental practices, I mean, you've gone in for some emergency cases because, you may have a patient that has, a badly infected tooth that can potentially actually become a much bigger problem. But right now, people are holding off on going in to see their dentist. What dangers does that pose for people in the long run if this thing goes longer than what we are anticipating for it to be a few more weeks?
First of all, we might unfortunately face a lot of root canal cases because of the advancement of the decay.
And what's a root canal? What's a root canal?
Root canal is a nerve therapy. So what happens is each tooth, the nerve of the tooth is where it hydrates the tooth, and it causes the tooth, it's the longevity of the tooth. When the nerve is hydrating the tooth, giving it nutrients, and so the longevity of each tooth is based on the nerve innervation of the tooth. So once the decay spreads and grows and spreads to the nerve and touch the nerve, you start experiencing high sensitivity and excruciating pain. And that's when the root canal therapy happens, which is removing the nerve tissue and filling it with very compatible material in order to save the tooth.
Okay, so root canals are going to be more common. What else?
Yeah, root canal, and also fracturing of your tooth because of grinding and clenching, which can happen a lot. So I also recommend for my patients not to chew on hard food like almond, popcorn,
I
which has
do all
the
the time.
kernel, which can go underneath your gum and causes irritation and infection. I recommend for them not to have any acidic drinks, which can promote decay. I also recommend for them to be very routine with their brushing, flossing. I recommend a water pick highly,
What's a
especially
water pick? What's a water pick?
water pick is like irrigation around your gum and in between your teeth. It's like really not like a cleaning, but it irrigates and it removes some of the debris that floss cannot, and it also goes underneath your gum, which and irrigates under your gum. So water pick is a great it's a great way of it can be a great way of cleaning and maintaining a good oral hygiene. I also recommend for patients to be very diligent, but very aware of not brushing hard and not brushing their gum hard, because that would cause recession of the gum.
Especially when you haven't seen the dentist for a long time.
Yeah, because patient would think, oh, I'm scrubbing, I'm really cleaning well, but that scrubbing will cause all the gum to recede and causes sensitivity, and in the future more complication. So using a soft medium toothbrush, not brushing too hard, but flossing and water picking is highly recommended. So what I do personally is I floss, and I use a different kind of floss. I use, for example, Glide in the areas that I have tight contact, and I use a Butler Weave gum floss where I have a lighter contact where it can remove more food particle, and then I water pick and then I brush.
Oh my God.
I know people think.
Wait, do you do your skincare? Do you do anything with your skincare or no? Because you work on all of this.
That's what you recommend as far as skincare goes, and my recommendation is for. So
yeah, see, we have a trading. She does all of my dental work. I do her Botox and fillers and skincare. So we have we're very lucky. We have like all-purpose family.
Yeah, we trade well.
Oh, and whitening. Oh, how about this? Can somebody say, okay, you know what? I'm gonna be home anyways. Can they go and get one of these Crest white strips and do whitening right now, or you think that's better not to do that right now?
I recommend Crest, but I recommend strips. But what I don't like about the strips is that they don't go well in between your teeth. So if you have dark spot in between your teeth, the strip just goes on the surface, and it does not do well for in between your teeth. So that's something that concerns me. So it's like you have white teeth, but in between you have all these dark lines.
So now that we're on this, I know this has nothing to do with coronavirus. What's the difference between like what people would do coming to you to get their teeth whitened and cosmetically enhanced versus what they can do at home with what you just described, the Crest white strips?
Well, I have to tell you, we do a lot of whitening, and what I use in my office does not cause a lot of sensitivity. Well, it's a one-stop thing. You are doing it in an hour and a half. It's safe. It's safe as much as it can be. Some patients really develop high sensitivity. And it takes an hour and a half. People don't have, right now they have time, but people don't have time to use the bleaching tray, and then as far as later on, they can just maintain it. We make a bleaching tray for them, which can last for a very long time. And they can buy like 3 tubes of bleaching and maintain bleaching, which is much easier than, having the strip which doesn't go in between your teeth. Some patients, if they can't afford it and they really would love to have beautiful smile, I tell them to try the strip first, But in-office bleaching is very easy. It's very convenient, and then maintaining it is easy as well. You put the tray in for 20 minutes and like once a month, and or before going out to a party, and you get that beautiful white smile.
Yeah. Going back to the coronavirus, how do you foresee going back? What do you think the changes will be in the dental offices? What changes do you think you're going to, and I know these are constantly altering and guidelines are changing, but what do you foresee based on what you know right now, the changes you're going to make with your patients and yourself as you go back to a routine of going back to the dentist?
So you know how I run my dental office. I have probably no wait time for my patients.
Yeah.
And that is the best way to do it. So patients don't sit in in the waiting area in order to be seen. So there's going to be a lot of changes. You need longer time. I mean, what we do right now is similar to what they're recommending, but the aerosolization problem is something that we have to be concerned about. Every day there are new guidelines and there are new equipment. So what we need to do is probably the room that we are doing extensive treatment that involves aerosols. We have to separate that room and see the next patient in another operatory.
Yeah.
So it's a longer appointments for patients. We probably, for patients' health and for our health, we probably would want to have the patient be tested. We will test ourselves as well in order to protect our patients. It's very important for the patients to be educated as well. So it's screening the patient the day before they come. We have to get in touch with them, make sure they haven't been around any person that has had corona or has symptoms. We want them to be symptom free. We should get their temperature once they go in, come into our office. So it's a lot of steps before seeing the patients. So we want the patients to be patient with our, screening, and we want them to know why we are screening them. Because when I was talking to one of my friends and I was telling her, this is what we have to do. She said, "Are you crazy? Who's going to go through this?" But it's not only about our health. It's about our patients' health as well. If they have corona and they come to us and we use the aerosols, if we have that aerosol procedures that involve aerosols, if the virus goes through their nose and their pharynx, they have a worse symptom. They're going to experience worse symptoms because it's not introduced to their lung, and it might not even be in their lung. Yeah. So it's all about taking precaution. So it will really alter our setting and alter seeing patients and doing procedures.
It's going to be a new model.
It's going to be totally a new normal.
And I think, like, knowing your practice, you have such a boutique practice where there's certain dental practices that it's like they're seeing hundreds and hundreds of people, multiple different, doctors, and you have a much more boutique, one person per hour, and that I think is going to have to become the norm probably for most other people. I think it'll be easier for you based on what I know to go and adapt to this, but certainly a model that runs on high volume, I think they're going to need to change a lot because at least for the foreseeable future, that's probably not going to work.
Everything will be on hold until there is vaccination, easy treatments, preventive, like easy preventive care for not contracting it. But yes, high volume dental offices will definitely, it's like restaurants,
Yeah.
social distancing. It's
Yeah.
everything will have a new normal, setting. So nothing will be the same. That's a challenge for all of us, I believe.
Okay, good. Well, I look forward to actually having you in the studio where we can talk about all the beauty as well as health and wellness related to dentistry and our smile and our dental care. And I hope that you remain safe and healthy, and love you lots. And
Love you too. I want to add something.
Yeah.
I don't think we ever thought that we were going to be doing this together, which is
this is so
amazing. And
so exciting.
and it's a privilege to be at the Smile podcast.
Okay,
Thank you
good.
for having me.
Of course. And we'll see you soon. Thanks, everybody. Please make sure that you leave your comments and any suggestions for podcasts below, and please give us feedback, and we look forward to seeing you guys soon. Okay, have a good one.